This episode of the ZuLoo Poodcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.
You drink this stuff and things start happening and you have to be within 10 feet of a bathroom for the next 10 hours.
It just empties you out,
It
right?
empties you out completely.
Okay.
But then it was kind of cool to wake up in the morning and know that there's nothing in my body. And
Right.
it kind of felt like a reset. I can choose. I was like, oh, I'm going to only put like really good things in here.
Right.
And then like 2 seconds after it was over, I was like, let's go get waffles.
You're not reaching for a Twinkie.
Yeah, it's like...
Welcome to the ZuLoo Poodcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humour, we aim to discuss and highlight the critical role toilets play in whisking poop out of our lives, the impact toilets have, or lack thereof, in the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
Hey, everybody. Welcome to another episode of the ZuLoo Poodcast. You may notice that we are not in our regular studio today. We are
Improvising.
in whose house?
ZuLoo house.
We're in the ZuLoo house.
Which is kind of nice to change it up a little bit, a little change of scenery.
That's right.
So thank you for letting us do this in the ZuLoo house.
Yes.
Yeah, we even drug out the old ZuLoo sign from the 1840s.
It is a cool looking sign. It
Little
looks
antique
very
there.
like it's been reclaimed.
Yeah, great grandpa ZuLoo. Yeah,
I love it.
I do too. I
great.
think it's really cool.
yeah.
So we got to sit down with Dr. Francis Reyes of North Carolina State University. Really, really enjoyed talking to him and his research that he's been involved in for a very long time with people all over the world. Darren.
Yeah, he actually teaches people how to run wastewater treatment plants. So, a couple of our episodes, we've obviously toured those types of places, and a lot of technology, a lot of engineering, brain power goes into those things. And he's the one that sort of trains people how to run them. And he's on the cutting edge of different systems like that. And it also does some stuff in, a lot around the world, different countries and stuff. But yeah, he's got a great TED Talk. He's the go-to guy when it comes to wastewater treatment plant and sanitation in general. He's one of those gurus that we're just super, happy to have him on the show.
Yeah, when I spoke to him, he's actually originally from the Philippines, so he grew up with sanitation issues in his home country. So he's really passionate about it, and his TED Talk's great, and it's pretty funny, and so he's
it's
a
cool.
good guy.
Yeah, it was fun. I'm sure maybe other people use this phrase too, but I hadn't heard before washers and wipers. Are you a country of washers or of wipers? Right. Which I thought was pretty funny. But
he grew up in I'll give away the interview, but he's grew up as a washer, right? Culturally, washing is a thing, but then came to the U.S. and we're the Stone Age.
Yeah,
I know,
we're still
so
wipers.
I know.
It does sound
we use paper
archaic when you think about it. Like we're doing it
we cut down a tree and we use that. There you go.
Yeah,
that makes sense.
It does sound very unevolved.
That's like an American thing. We've got tons of trees. Let's just cut them down and use that for toilet paper.
Let's use that. Let's not.
I always think of the movie, what is it? Dances with Wolves, that old movie, Kevin Costner. And they got the guy, I don't know if you remember the movie.
Of course.
Yeah, you got the guy.
Classic.
Was one of the where they, I guess
like
they were like one of the cavalry
generals.
guys. They had arrested Kevin Costner for being an Indian, and or American Indian or Native American. And anyway, they found his journal that he had been taking notes, and he's like, give me some of that paper. And they're just ripping sheets out of this his journal to, do their business, right? And just
of course Darren would remember that scene. That's not one of the scenes I recall. But.
And their water source where they get their water, they're just crapping right there. It's like, well, okay, not a lot.
There's a better way, folks. There's a better way.
Yeah,
it's called a bidet.
That's right. And I don't want to offend any.
There's a better way. It's called
don't want to offend the U.S. cavalry, right? But
or wipers. Like to each their own.
Yeah.
But if you haven't tried washing, I highly, highly recommend it.
Right.
So we will get into that interview in a little bit. But Darren, what is new in the poo news?
The poo news is I we've been reading up a lot about, when you told me you were getting your colonoscopy the other day.
Yes. Easter egg. There's a colonoscopy episode coming soon.
I need to do some research on it. And in the news, it's kind of a trend. We think we've talked about it before, that it used to be colon cancer was only if you're 50 and older.
Mm-hmm.
There's a big trend. Millennials, Gen Z, in their 20s, 30s, and 40s are getting it.
Really? I didn't know it was that young.
Yeah,
I didn't either.
It's a big trend. And they're seeing more and more often. And
That's concerning.
and they're really not sure exactly why. It's not because, it's usually related to smoking, obesity,
colon cancer,
poor diet, and things like that.
I didn't know that.
But, and they also said, and also genetic, right? They say, there's some genetic history there. But a lot of these younger generation cases, there's none of that. There's no...
And they're still getting it.
And they're still getting it.
Yeah.
Right. And
that's interesting.
Does that have anything to do with the vaping? Because you say, I wonder if, I don't know.
It just says we are seeing a clear uptick in colon cancer among younger generations. This is Yale Medicine, PhD. It's still more frequent with people over 65, but it's that group is declining. They're actually fewer and fewer. But then this younger generation is getting it, and basically they're saying, hey, if you've got any change in your bowel habits, like bleeding, even if you just think it's like hemorrhoids, just go get a colonoscopy just to be sure, right? And I've never had one, so I don't know. Can't really speak to that. But
let me tell you all about it.
We were hoping Jocelyn
I did the deal where you just send a sample in and you mail it in.
You took the easy way out.
I did. And they say that's just as effective.
Okay.
Well, I wish someone had told me that before I starved for 36 hours.
I know. I drank that awful.
It was, here's the thing.
Mm-hmm.
I was really nervous about that part of it because I've never gone more than 8 hours without eating ever.
Yeah.
I'm just
really?
Fasting is not my deal.
Yeah.
Okay.
However, I will say after hour 16, 18, you just give up and you're like, this feeling isn't going away. I'm going to stop worrying about it. It's fine.
Mm-hmm.
And then, you drink this stuff and things start happening and you have to be within 10 feet of a bathroom for the next 10 hours.
It just empties you out,
It
right?
empties you out completely.
Okay.
But then it was kind of cool to wake up in the morning and know that there's nothing in my body. And
Right.
it kind of felt like a reset. I can choose. I was like, oh, I'm going to only put really good things in here.
Right.
And then 2 seconds after it was over, I was like, let's go get waffles.
You're not reaching for a Twinkie.
I was like,
I mean, it wasn't that bad, but I was so excited to eat
Where's
food.
my Dr. Pepper?
But yeah, I mean, I am not, in the 65 and older, and I'm not a millennial, but there's a family history of it. So I assumed that it was more, caused by genetics. I wonder if the younger thing, though, is caused by stress. I feel like the younger generations are experiencing a level of stress and emotional, anxiety and all the things that it just seems kind of unprecedented. I don't know. Maybe not. There was World War II. There were teenagers going off,
just
to the other side of the world.
Yeah. So it's just something that they said if you're getting any rectal bleeding, unusual stool, changes in bowel movement, low energy, these are all indicators that, hey, maybe something's going on. You might want to, doesn't matter your age, right?
Yeah.
If any of that's going on, you should just go. But the other thing is about, talking about options, right? There's options now that instead of recommending a colonoscopy right off the bat, there's new guidelines that are coming out that says, hey, look, you can do a blood test or a stool sample instead of just going and getting a colonoscopy. It's obviously, as you can attest, probably it's a little bit invasive, right?
It's a commitment.
It takes time.
It takes a lot of time. You have to take time off work, and
someone needs to drive you home.
Yep, it's pretty intense, but
right, because you got to get anesthesia a little bit and all that, right?
Although that was awesome.
Yeah,
I haven't been put out for a while. I forgot how fun that is.
Okay,
it's great.
You're like laughing gas. Let's do it.
Leave it to Jocelyn. I just want to be put out.
It was great. He's like, you're going to start feeling sleepy in 30 seconds. And I was like, oh, cool. That was it. I don't even remember getting drowsy. It was just lights out.
Wow.
And then
but then you wake up, you sort of
It seemed like I had blinked and it was over, but you still have the feeling of like having dreamed and like, been in a REM state. It's cool.
Kind of a way to relax. Yeah. So if you're high stress, maybe just go get a,
instead of going a twofold.
Instead of going to get a massage, you
meditation,
kill two birds, one stone.
Right. Instead of practicing some Zen meditation. Just go get a colonoscopy. Just
get some general anesthesia.
I think that would be the last thing that people would do. Oh.
Yeah, they say that this, so as far as like inflammatory bowel disease, IBD, affects like over 500,000 Americans currently. Crohn's disease, I guess they call it. But they say that biomarkers can be used to, it's really due to inflammation in the gut, right? Something's going on. And so it used to be that like a blood test or just a stool sample wasn't like really accepted. It's like, oh, we got to do the colonoscopy.
Yeah, they got to really get in there.
But now they're saying, no, that's really not the case. That you can do a stool sample instead. And because the biomarkers that they can see that, lead to colon cancer, if they're absent, then, maybe you just don't need to get the whole Roto-Rooter experience, right? Right. So,
but you're missing out.
Maybe you're missing out, right? So, yeah, because that sounds like more fun than just.
It was an experience to be uncomfortable, not eating that long. I mean, I don't know if that's hard for anybody else, but it was for me. And then, getting to the hospital and doing the whole thing, and then finding out that you're totally clear and clean. It was like, oh, great.
There you go.
Yay. I have no problems now.
And they give you a report like right afterwards?
They give you pictures. You can see the inside.
They print out
colon,
they print out the information.
Cool, actually. Yeah.
Okay. Are we going to see them?
If you're lucky. I'm working on a little thing. You'll see.
Okay.
Oh wow, you're going to make a flip chart for us?
Yeah, we would love to see.
You can't make me laugh. I'm getting over a cold. There was some footage taken of me waking up from this experience that I haven't watched. I don't know if that will be made public, but anyway, we are going to...
A little documentary. We'll look forward to it.
Yeah. Let's jump into the interview.
Well, we are so excited to be sitting down here today with Dr. Francis Reyes, who is a professor at North Carolina University and doing some really exciting work that we are going to dive into in, the sanitation space, water treatment, all of that good stuff. But just to start, we would love to hear a little bit about your background. And we always want to know the road people took to sanitation, because it's usually an interesting one. So, tell us a little bit about yourself.
Yes, thank you. Yeah, thanks for having me here. I really appreciate the chance to talk about something I'm passionate about. So I grew up in the Philippines, and that's where I did my undergraduate studies. And then I went to the US to do graduate work. And I was trained in what I would call traditional engineering, wastewater treatment, biological processes. And that's where I did my PhD in. And so it's about the design of large-scale wastewater treatment plants, for example, and microbiology. How do you use microorganisms to treat these wastes? But growing up in the Philippines, I've been always exposed to underserved communities, informal settlements where people don't have, proper housing and access to sanitation. So I knew that the stuff that I was teaching here at the university and the stuff that I was imparting to my students was not really applicable to maybe, most of the world, really. Mm-hmm. And so I decided many years ago, more than a decade ago, to sort of go back to my roots and use what I know in terms of the engineering principles and microbial principles to think about solving or addressing the challenge of sanitation for underserved communities in low and medium income countries.
Mm-hmm. Yeah. And can you, for a lot of us in the US, it might be hard to kind of imagine what some of those challenges are. And they differ, depending on, where in the world we're talking about. There's cultural differences. There's, availability of resources that changes no matter where we are. So explain to us and to our listeners some challenges that you saw that you wanted to tackle.
Right. Yeah. Well, first of all, I think we take it for granted in the developed world, right? In the US, when we need to go, we go to the toilet and there's a nice clean white ceramic bowl. We do our business, we flush it, and we don't really think about it.
Mm-hmm. You don't think about it until it stops working. And then it's a big problem. That just happened to me this weekend. We had a whole situation, and you realize how lucky you are to have plumbing when it stops working.
Right. But the whole infrastructure is hidden, right? The pipes from your house to the street, the sewer lines from the street, and from all of the town and the city to the wastewater treatment plant. That's all hidden, and it's all supposed to work. I mean, I challenge most people to tell me if they know where the wastewater treatment plant in their city or town is. Most people don't know, right?
Yeah.
But for communities that don't have access, it's almost a daily challenge, right? For those without toilet facilities at home, you almost have to plan your day around it. Sometimes you have to hold it in, and there are stories of people actually waiting, especially women, for example, in South Asia, waiting until the cover of night before they can go out, because they can't go out to the communal facilities because they fear being harassed and so on.
Yeah.
And then for a lot of people, it's the experiences, and if you go to if you have to go in some of these communities, the experience is even traumatic if you want to think about it that way. It's dirty, it's smelly, sometimes it's dark.
Yeah.
So the facilities are just not there. But people, get used to it. I would say people get used to either the good life or dire situations. And at the end of the day, it's really risking public health. There are risks to public health, stresses, and all of those things that are associated. And of course, we have the statistics in terms of infections and deaths and so on. But really, it's a quality of life issue. It's a human dignity issue. And something that we take for granted here, for a lot of people, it's a daily challenge, and they really have to worry about it and get used to it. And that's not right in a society where we have iPhones and Wi-Fi and high technology, and yet almost half the people around the world don't have access to sanitation services that we consider safely managed. In other words, not only do they have facilities at home, basic access, but their wastes are actually managed safely. So sometimes you do have a toilet, but then it just goes to the environment pretty much, not treated.
Mm-hmm.
Yeah, I'm curious to know what is the situation like in the Philippines? I know a lot of ZuLoo's work currently. We're doing projects in Africa and also in India. What's the I've never been to the Philippines. What's it like there? You grew up there, right?
Yeah. So the Philippines is not at the bottom, if you will, of countries if you compare them to Africa, for example. There are water resources. It's a washing culture. We have wipers and we have washers, right, for anal cleansing.
Mm-hmm.
It's a washing culture. Most of Southeast Asia, Muslim countries, they use water for cleaning, and it's a flushing culture in general. So it's water based. And I think the statistics are maybe 8%, for example, in terms of open defecation. So there is some. And I remember, for example, in college when we went to a barrio and there was no facility in the house, we were told to go to the fields, right? The rice fields, and do it there. And that was quite an experience.
Mm-hmm.
Yeah. So it's not too bad. The issue really is, again, underserved communities, and also not just public health risks, but also threats to the environment. So the water environment is contaminated, and for a country that's surrounded by water, it's an archipelago with 7,000 plus islands. We need to protect our water quality, and the inland lakes and rivers are especially in the metropolitan areas, are quite polluted. But there's some movement in terms of cleaning up some of the major rivers. In Africa, again, depending on where you are, if you track the mass balance of fecal material, so we have something called the shit flow diagram. I'm sure you've heard of this. The SFDs, which tracks the all of the waste being generated and where they're going. So it's kind of like 100% mass balance. Some cities, they're showing 90%, 98% of all the fecal material as ending up in the environment untreated, largely untreated. So, I think in the Philippines, it's a little bit better than that, but it still is not perfect.
Mm-hmm.
That is a high percentage. Yeah, that is higher than I thought.
98%.
And again, it's city by city. Sorry, I'm
sure.
Some examples. A very famous case is Dhaka in Bangladesh, where that 98% figure is the figure that people cite. I think it's gone down now. There are some large sewer and wastewater treatment infrastructure projects going on in Dhaka, and then some other cities in Africa and Asia are not quite that high, maybe 90, maybe 80%. Yeah.
Mm-hmm. Well, it was really fun to read your bio and to watch that video explaining what you are, what your research is about. And I loved how you said, we're focusing on turning waste into resources. I thought that was such a great way to look at it. We can take something that we consider wasteful and turn it into something useful. So can you speak a little bit to the specific research that you're working on there at the university, and what results are you having? What are you seeing?
Yeah. So maybe stepping back is thinking about the whole sanitation system as a chain. So most people focus on the toilet because that's kind of like the visible part of it, but that's really just the first step. And you have problems with that interface, and then you have to contain the fecal material, the human waste. You have to transport it, and then you have to treat it, and then dispose of it eventually. So in the US again, and in developed countries, we don't see the transport, the treatment. It's all hidden. But
unless you're me and Darren, because we've actually done a field trip to the waste treatment, to the water treatment facility. We got a whole tour. It was pretty fascinating. But you're right. Most people, they don't know.
Right. But then in other countries, it's very visible. It may be a pit latrine, for example, and it's contained. Pretty much, you have a hole in the ground. Maybe it's several cubic meters, and then you have a concrete slab. Sometimes it's just a soil slab. That's it's a floor that's reinforced by wood or bamboo or whatever.
Yeah.
There's a hole, and basically the containment is basically under you. And then when it's full, it's either abandoned and you dig another hole, or if you don't have space, then you have to have it emptied. So then you need that technology there for emptying, and as you know, in many countries, this is still done manually. Like people actually go down there and do it, hand over hand, bucket by bucket. And they're again exposed to all of these pathogens. Emptying, transporting it, and then treating it at a facility. And in many places, there is no facility. So they end up basically taking these containers and dumping it actually to the river again. And so it's kind of like, I call it massive open dumping, right? Open defecation, because you basically collect a few years worth of fecal material and then dump it at one time.
It's almost worse, right? Than if it came in, small increments rather than one big dump, right?
Right. And so you ask about the research. We have research on almost all of the different phases. From the human interface, the bowl itself. For example, how can we design a toilet seat and a bowl that you can flush, let's say, with half a liter of water, right? If it's a flushing culture. to the removal of fecal sludge from pit latrines so that we avoid the manual removal. So we've developed a technology that has been funded by the Gates Foundation. Uh, over like 10 years, we developed this machine that can actually help remove the fecal sludge and make it safer for workers. We look at the risks associated with transporting. Let's say you have vacuum trucks. Um, what are the risks to the workers, the community, and so on. And then at the treatment side, we do research on, for example, converting fecal material and other wastes, for example, food waste. How do we convert that to energy like biogas or other resources that it can be higher value acids that can be used for chemical industries. But we have a lot of work done on biogas and energy conversion. Yeah.
Yeah. So you mentioned the Bill Gates Foundation and the technology removing fecal sludge, and then the biogas. What technologies do you see that are coming up in the future that may have an impact in how we currently do things? What's the future look like from your crystal ball?
Yeah. Well, I mean, I think the hope was a magic, silver bullet, like a one technology that can fix it all. But I think what we've come to realize in this field, and I'm not alone in thinking this, is that there is no one silver bullet, and every context, every situation is going to have a different solution. For many countries, it may not be a water-based solution. For some countries, it might be a decentralized solution, which means that instead of having treatment for a whole city or a whole town, it may be treatment for, say, a group of houses, or at the most decentralized level, actually treatment at the household level. My kind of like hope is actually in the US. We demonstrate how we think of all of this as one water, where we recycle our gray water. We don't use clean drinking water for flushing our toilets. It's kind of like, we clean it to the level of of drinking water quality, and yet we use it to flush our toilet. That's really not logical, right?
To use like drinkable water just to flush your toilet seems
right.
crazy, right?
Right. So how can we show at the household level that we can recycle all of these and minimize energy, minimize water? It's interesting, in the West, this is something that San Diego is looking at now, right? California is looking at it because of scarcity in water. Although right now they're under a lot of water, so it's the issues with climate change. So that's the other aspect to this, is that the situations in many different countries might change with respect to water availability or water supply. Culture is a big thing, where basically, some people will be, washers, and some people will be wipers. In my crystal ball, I think I see a lot of the world switching over to very efficient washing instead of wiping. I think a lot of people now realize that you can buy, for example, a $20 bidet attachment to your toilet from Amazon. And you can use that to do touchless. You don't have to touch yourself. You just press a button or a dial, and it basically, you do your cleansing there, and actually that's more sanitary, right? So, I foresee in developed countries trends in this direction, and then in countries where they need infrastructure, it's going to be context adapted solutions, whether at the household level or groups of houses or communities. because the centralized system of sewer lines and centralized wastewater treatment is probably not going to work for everybody. Yeah.
I think that's one of the things you know, it's been confirmed over and over again after speaking to so many people in this space. There is no one size fits all solution. What works for us in the States is not going to work all over the world and may not even work from state to state based on the different pressures we're feeling from climate change and policy and, all the things. There has to be, many solutions to this problem. But just, going back to the switching from this wiping mindset to a washer mindset. I am such a convert to the bidet, thanks to Brondell. They were generous enough to give me one, and I've had it in my bathroom for about 2 months. My girls love it. I love it. My boyfriend loves it. Really, people, if you haven't tried a bidet, it is the way to go.
Yeah, I think you're a recent convert to being a washer. Sounds like Jocelyn, right?
Yes, absolutely. And I am a full disciple. Go try it. I promise you, it's life changing. It really is. It's so nice. And it's a level of clean that you just don't get the other way around.
But it's also an interesting experiment, if you will, in terms of culture change, right? Because this is interesting. So I grew up in the Philippines. It's a washing culture. And then I moved to the US. It was a wiping culture. So I became a wiper. Mm-hmm. And then now I'm back to being, again, a bidet user, a washer. Obviously, I get to it when I'm outside my house, right? But so people can change. Historically, for example, the Japanese, pre-World War II and earlier were wipers. But now they're washers, right? So the Toto toilets and all of that changed the culture. Mm-hmm. So I think there are some that I think will not change. They will always be washers because of religious reasons. Mm-hmm. So I think this interplay between culture and technology in the sanitation area is really, really interesting, because there are some solutions that require people to switch their thinking.
Yeah.
For example, composting toilets. Well, we're used to just flushing it and forgetting it. We don't want to once a week or every few days empty something, handle it ourselves, right? That's kind of like too much hassle. But for some people, they've made the switch and they actually, it's part of their lives and it's okay. So I think there is something to think about in terms of technology and culture if we're trying to address these issues. So there, like you said, there's not no one size fits all. There are really interesting things that are at play.
Mm-hmm. It is pretty fascinating that, this thing that is required of us as humans to take care of multiple times a day there's so much more to it than just, going to the bathroom. There's religious implications, there's cultural implications, and, there's global implications. It's such a multifaceted issue, and it's such a simple thing that we just have to do. But when you sit back and look at the big picture, it affects so much of how we are able to, whether or not we have access to clean water and a safe place to go to the bathroom. It really affects the rest of your life.
Yeah, it's a quality of life issue. It's a human dignity issue. It's a quality of life issue. But as a society, it's not only an inequity issue, but it's also an economic issue.
Yeah.
So, you can look at the papers, for example, and in some countries, the direct and indirect impact. So direct might be, diseases and deaths, and then the indirect impacts might be, stunted growth because, malnutrition arising from diarrhea and infections, or girls not going, missing school. They're not going to school because when they have their menstrual period, they don't want to go to school because there's no facilities and so on. If you add up all of that, in some countries, it's maybe 2%, 3% of their GDP, right? Which is a huge number. And in the US, we think we're good, but there are actually 2 million Americans who don't have basic access to water and sanitation. And the organization Dig Deep did a study that they released last year, and they quantified the impact of that. And the number was $8.58 billion every year. So it's real money. And it's not just that we're leaving certain communities behind, but it's also costing us real money. And so it makes sense. I mean, the international data is that for every dollar we invest in sanitation, we get, $3, $4, $5 back benefits. So it makes sense. And it's just a matter of, well, there's a lot of issues, but as you know, so it's up to us. And I think, ZuLoo is, you're doing your fair share in getting the word out there and advocating for this challenge, meeting this challenge.
Well, it's been, I think, eye-opening for both Darren and I. We talk about this stuff all the time, and yet every guest we have on, you enlighten us to, something that we hadn't thought about. Or what's really exciting is when we hear about solutions and things that are working.
Right.
I would love to hear, we've got a few minutes left. Leave us with like some hope. We talk a lot about how big the issue is and how complicated it is, and it is complex. But I would love to hear, what is working? What can we be excited about?
Right. I'm most excited about the passion that I see, right, from people that I meet. In the research community, there are people all over the world, in the US, in Europe, in Africa, in Asia. There are NGOs like, ZuLoo that are passionate about this issue. And when I talk to young, children, middle schoolers, high schoolers, once they hear about this and they do some more research, they're really passionate about this. And I think people understand that in a world where there's iPhones and there's Wi-Fi and high technology, and yet a little bit less than 50% of the world, 3.6 billion people don't have access to safely managed sanitation. There's something wrong with that world. And I think a lot of young people are understand that that's something that we have to work on. So to me, the future is bright because we've got this generation of students and young people who, once they get to understand the issue, are willing to work, for that. So I'm always inspired, when I talk to you, Jocelyn, Darren, I meet new people in the space. I'm always inspired about, how people respond to this, and either spreading the word, working on technologies, doing research, working on the ground in communities. There's always hope. So, I think this is something that we can tackle, and I think we can do it. It's just trying to inspire other people and really being more creative and changing some of the ways, the way we think about some of the solutions.
Mm-hmm. Amen. Hear, hear. Well, Dr. De Los Reyes, we really appreciate your time and your expertise and what you shared with us. It's been a real pleasure to talk to you and hear, what you're doing, what your research is all about, and, the hope that you have, the passion that you have. We would love to have you back on in the future and kind of hear what else is going on, what's new in your research. We just are so grateful that there are people out there like you who are making a real difference. And we really appreciate you sharing your time with us today.
Well, thank you. Thank you for this opportunity. Really enjoy this.
Awesome. Okay. All right.
Thank you.
Well, we'll talk to you soon.
Okay, thanks. Yeah, bye-bye.
Thank you. Bye-bye.
All right. Great interview.
Yeah.
Really, really loved getting to know him and hearing about what he's doing, learning more about washers and wipers.
Very brilliant.
Super brilliant.
Mm-hmm.
Yeah.
But still very relatable and down to earth. I loved hearing, he has projects going on all over the world. And like, we mentioned before, he's been doing this a really, really long time. But it was fun to hear about his experience coming to the States and having to switch from the washing culture to a wiping culture. And
And actually, he was recently at a conference in South Africa with Berger. Yeah.
Oh, okay. Yeah. That's how Berger introduced him to us.
Yeah, Berger was a former
or us to him
Poodcast guest from Sweden.
That was before my time.
Yeah. And so anyway, we'll have to talk more about that later because they're having a lot of success with what Berger's doing. So
yeah, we're excited to go see Berger in South Africa. There's a rumor floating about I don't want to give anything away, but it's possible that the World Toilet Summit could be in South Africa.
Oh, that's cool.
In Cape Town. So
oh my goodness, that would be amazing.
We're supposed to keep it on the down low, but we just said it on our
podcast. So viewers, everybody,
don't tweet it.
Be quiet. Just keep it to yourself. Don't share. Well, just share part of the episode, not the whole thing.
Yeah.
So anyway, but that's just a rumor. Maybe it could not happen.
It'd be a great place.
That's where those sharks jump off or jump in the water like dolphins. Haven't you ever seen that documentary?
No.
Oh yeah, it's
that's
big
totally
shark,
off topic.
Big shark thing.
Yeah,
but
it's super cool.
Yeah, we got in trouble last year because we kept on promoting. Hey, we're going to go to Tokyo, and then
it never happened.
I know.
Okay,
so
this
we don't want to jinx it.
Not happening.
So disregard.
We are not going to South.
We're not going to South Africa.
It's not happening.
Not happening.
All right. So now you know what's not happening.
Yeah.
Okay.
But thank you so much for joining us for this episode. We hope you enjoyed it. We hope you enjoyed listening to it as much as we enjoyed making it. And we'll see you next time.
Thank you for listening to the ZuLoo Poodcast. Follow us on social media at our links in the show notes below. To learn more, visit our website, ZuLoo.org. If you liked the podcast, be sure to subscribe, like, and comment. For even more ZuLoo fun, send us an email with your toilet stories to podcast@ZuLoo.com for a chance to be featured on the podcast. This episode of the ZuLoo Poodcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.